My name is Joanne Alfaro, and I am doing my cancer presentation over uterine cancer. Um, so to begin, there are basically two types of uterine cancer. One is the endometrial cancer, which is more common and more likely to be cured. And then there is the uterine sarcoma, which is rare and more aggressive, so it's harder to treat. Um, so basically, as a female, and I'm sure most of you can relate with having mothers, um, grandmothers, daughters, nieces, it's important to be educated and informed on one of the most common types of cancer in females. Um, so, although it is curable if it's found soon enough, if we ignore the signs and aren't informed correctly, then it could be fatal. So, that's what I wanted to shed some light on today on uterine cancer. So, for the history of uterine cancer, I broke it up into two parts. Part one being endometrial carcinoma specifically. So to start out with that, endometrial carcinoma is a cancer that starts in the epithelial cells. The cells that line or cover most organs are called carcinomas. And carcinomas starting in the endometrium, lining of the uterus, are endometrial carcinomas, which is where it got the name. So basically, endometrial cancer starts when the cells in the inner lining of the uterus, the endometrium, begin to grow out of control. And when this happens, that's when it becomes cancer and it can spread throughout other parts of your body. So cancer, this type of cancer is one of the most common types, and in most developed countries with access to sufficient health care, it's very treatable if it hasn't gone too far in stage. So approximately 95% of these malignancies are carcinomas of the endometrium. And although it is curable or treatable if found soon enough, it is the fourth most common type of cancer in females, and that's accounting for 7% of the female population, following breast, lung, and colorectal cancer. But due to, like I said, due to most patients finding out in the early stages, only about 4% of cancers of this type of cancer actually ends in death. So unfortunately, other than that, I couldn't really find much history on uterine cancer as a whole. I couldn't trace it back to a specific person that discovered it, just because there's still so much people are researching about. It was never heavily documented or reviewed, so there's still a lot of research going on. But I did find in one of my sources back in 657, Paul of Aegina wrote the Epitome of Medicine, where he discussed what to do in surgeries, and in it he stated that surgery on uterine cancer was useless. Although that doesn't really answer a lot, it kind of gives us an insight as to how far back uterine cancer has been kind of a problem and how far back people have known about it. So moving on to the history of uterine sarcoma, which is the other type of uterine cancer. Sarcomas are cancers that usually start from the tissues, the muscle, fat, bone, and fibrous tissue. So although it's not as frequent as the endometrial cancer, because it is much more aggressive, it is mostly lethal. The 5-year survival rate reportedly ranges from 30% to 68%, which isn't that high of a number. So that's why this is, although it is much more rare, it is a lot worse for you. So, and just like the endometrial cancer, I couldn't find much history on it either. So if you view my PowerPoint slide, you can see that I added some pictures of what a real life someone with a real life uterine sarcoma, where they had taken the uterus out, and what it looks like. So it's pretty crazy. So moving on to treatments. So once again, I kind of split it up in between two. So starting off with endometrial cancer treatments. So basically what you can do if you are in the beginning stages, stage 1, you just discovered it, it's early, one of your options is to have surgery. In this surgery, basically what's done is your uterus, fallopian tubes, and ovaries are removed, as well as the lymph nodes around the aorta. And once they're removed, they're examined to see if any cancer has spread, and the tissue is also examined to determine how far it spread. So basically to find out what stage of cancer you are. So depending on the stage and the spread, they'll remove the cancer, but more treatment may be needed, so they may recommend radiation or chemotherapy on top of that if it spread a lot more than they thought. So for the second option is radiation. So radiation is an option for patients showing more stage 2 cancer and more progressed and needs more maintenance than just surgery. So radiation therapy basically uses high energy radiation, such as X-rays, to kill cancer cells. It can be given in 2 ways to treat endometrial cancer, by placing radioactive materials inside the body, which is called internal radiation therapy or brachytherapy, or by using machines that focus a beam of radiation at the tumor, much like having an X-ray. That's called external beam radiation therapy. So that's your second option, but it does have some side effects. So you can be weak. It could affect, just your stamina as a whole. So there are side effects with all of these. So for your third option is chemotherapy. Chemotherapy is the use of cancer-fighting drugs given into the vein or by mouth, and these drugs enter the bloodstream and reach throughout the body, making the treatment potentially useful for cancer that has spread beyond the endometrium. So if you choose this treatment, you may receive a combination of drugs, and some of the drugs that are used are known as carboplatin, paclitaxel, doxorubicin. Those are just some of the drugs that they administer, and some of them are usually mixed together, or combined for chemotherapy. So that is your other option to treat cancer, and like it said, it's for those that have spread beyond the endometrium, so in other places of your body that radiation or surgery can't necessarily help you too much. So for the fourth option, you have hormone therapy. And hormone therapy, that's a type of treatment that uses hormones or hormone blocking drugs to fight cancer. Some of the hormone drugs used to treat endometrial cancer are progestins, which are the main hormones used. There's also tamoxifen, luteinizing hormone-releasing hormone agonist, and aromatase inhibitors. So those are just some of the hormones used for this type of therapy. And like it said, it's a treatment that basically hormones are released to either block or fight off cancer. So that's another form of treatment you could use. Moving on to uterine sarcoma, the treatment for that, it's very similar, basically the same thing as the endometrial cancer treatment. You can do surgery, radiation, chemotherapy, or the hormone treatment, but there are more risk factors in uterine sarcoma, specifically to x-rays or radiation. Because it's a more aggressive type of cancer, being exposed to x-rays can increase the risk of uterine sarcoma. So it may give you the opposite effect that you're looking for. Some of the tests that are used to see if you have uterine sarcoma is the pelvic exam or the pap test, which can help you indicate whether or not you have this type of cancer. Currently, there are new treatments in clinical trials and more treatments that are being created and waiting clinical trials by scientists. So hopefully we can get some of those soon, so that way we have more options for people that do suffer with uterine sarcoma. For the prognosis, so this is basically information I found for uterine cancer as a whole. As I said earlier, I gave you some statistics regarding the uterine sarcoma, which is the 5-year survival rate for that ranges from 30 to 68%, which was not very high at all. But for uterine cancer as a whole, the 5-year survival rate for women with uterine cancer is 81%. When the cancer is diagnosed, if it's still confined to the area where it started, which is called local, then the 5-year survival rate is 95%. If the cancer has spread, the 5-year survival rate is about 69%. If it is diagnosed after the cancer has spread into other areas of the body, survival rate is 16%. So like I said, this is just statistics over uterine cancer as a whole. So some of them are a lot higher than what I stated was for the uterine sarcoma, simply because the endometrial cancer is a lot more common. So that is what most of these statistics are based off of, since it's a lot more common, like I said, and the uterine sarcoma is really rare. So for the future, as I said, I read in one of my sources that there are new tests currently going through or awaiting clinical trials for uterine cancer. Unfortunately, cancer has just been always something that has stumped us. We can't seem to find a cure. We have ways to treat it, and could be cured if it's early enough, but it can always come back, and if it's too late, then unfortunately it is fatal. So with that being said, scientists are motivated and working hard to fix this and hopefully come up with a cure that will save thousands of lives and spare them from the awful experience that is cancer. So my decision to research the uterine cancer was mostly based on my family history. Most, if not all, of my family members, women, have suffered with uterine cancer. Thankfully, they've all, most of them, have caught it on early enough to where they have gotten treatment for it and they're fine now, but they still go in regularly to get checkups to make sure it hasn't come back or it's not somewhere where they hadn't seen it before and progressed. So my mom was diagnosed with that, but thankfully she got it taken care of and she is getting treatment and she's fine now. So it is something that I wanted to research because I'm more prone to it since it runs in my family. So I really wanted to be educated on it, kind of look out for the signs that I wrote about and just be more informed about it overall. That way I just have, I'm more prepared and I know when to go see the doctor if something isn't right, which is very important. So thank you for listening, and yeah, just leave me questions or any comments below. Thank you.